So you have lower back pain on the right side of your body. What causes that? So on our spine, we have what we call facets. And facets is a fancy word for the joints in between one vertebrae to the other. So when you have pain on one side of the body, if it's the right side for you, and it's very localized in that region, it's very likely a facet irritation or a joint irritation. So what can you do about that and how can we fix that? We're gonna talk all about that in this video. Hey everyone, what's going on? My name is Dr. Justin Lee, physical therapist here at Village Fitness and Physical Therapy, where we help ages 40 and up get out of pain, get active, lose weight, and take back their health. So if that resonates with you, feel free to subscribe and hit that like button. Like I mentioned, your back is comprised of facets or those joints. So what is causing that pain, right? So that joint irritation, pretty much when one joint compresses on top of the other, you're gonna have that pain. But the opposite is true. When the joints open up and decompress, then you're gonna feel some relief. So the first step to making sure you're feeling relief is to decompress the joint. Then the second step is to make sure that we are compressing and getting your body used to that, but not over compressing in the beginning. It's gotta be a gradual process. So first we open up to get you out of pain, then we start compressing and slowly getting into it because yeah, you're gonna have to move in that range of motion. So here's a couple rules that you need to follow that's gonna be helpful for your back. Number one, anytime that you're bending over or flexing the spine this way, that's gonna decompress your back. And anytime that you extend your back or arch your back, that's going to compress your back. That's why when you have pain on the right side, very likely the positions that compress or irritate your back are when you arch, when you bend over to the side or rotate towards that side, or whenever you stand up. See, what happens is when you sit down, your back kind of flexes. So it kind of feels good when you sit down. But as soon as you stand up, your back starts to arch and it compresses and that hurts. Same thing if you have pain while you're sleeping, same thing. If you're laying on your back, legs are straight, no pillow, that creates an arch in your back. That kind of hurts. So how do you fix that? Boom, put a pillow or two under, and that kind of rounds it out to make it feel a lot better. So we're gonna go over two exercises that you can do right now to first decompress the back, and then secondly, start to introduce some of that compression so you can gain your mobility so that you can feel a lot better on the right side of your back pain or on the left side. Okay, so here we go. First exercise, first stretch that you're gonna do. You're gonna lay on your back. You're gonna bring both knees to your chest. Woo! That's gonna be a fantastic stretch to really get some relief. Open up that backside. As you can see, my back is starting to bend and flex, which is gonna decompress that low back. If you need a little bit extra room here, if you're really flexible and these knees go to your chest really easily, what you can do is you can put a pillow under your pelvis and bend that way. That way you get even more stretch. But if your knees are hard to bring to your chest, don't worry about that pillow. Hold that for 30 seconds, take a break, and do that throughout the day for the entire day to get your pain and inflammation down. All right, second exercise, we gotta start introducing some of that motion, right? So I love this exercise. I give this out to so many of my patients, especially when we're reintroducing motion. These are called windshield wipers. Feet are together. You're gonna rotate your knees over to one side. Then you're gonna switch and go to the other side. Now it's really important when you do this to stay within 45 degrees-ish, right? First, you should not feel pain with this, but this is gentle enough to introduce motion compression and decompression to your back. Once you do this for about a week or two, then you can start increasing that range of motion a little bit more and a little bit more. The most critical thing here, and I gotta sit up because I gotta tell you this, is that you do not want to push and force your knees over to one side, thinking no pain, no gain. My friend, yes pain, no gain. That is what it's about. And you do not want to go there. So take it easy and gentle. 45 degrees first, and then eventually open it up. Get a good stretch, don't force it, then switch sides. Do 20 of those, 1, 2, 3, 4, 20 of those every hour to reintroduce that motion. And as soon as you know it, that pain on that right side of your body, whew, it's gonna feel a lot better. Hey, if this information has been helpful so far, I really would appreciate you give a like and add some comments if you have some questions below. If your back has been persistently bothering you, then you might need some professional help. Myself, who's a doctor of physical therapy, and our other team of DPTs can definitely help you out. Feel free to sign up with the link in the description and we'll get in contact with you and we can find a solution together to help you get out of